Hi everyone, and welcome to our fourth and final webinar of our Applying to Core Surgical Training series by the UK Plastics Research Collaborative. Thank you so much for joining us this evening and for being participative throughout the course. So we've had, an introduction to the MSRA, how to get going with a good portfolio, how to prepare for interviews, and today we're sort of wrapping everything up. And we'll actually have a two-part webinar. The first part will be a general Q&A. And for that, we've asked our followers on social media to send us questions in advance. But friend not, if you haven't, there's a Q&A function built in MedAll, and you'll be able to send any queries or doubts in there. Whereas the second part will basically tell us how we can logistically apply, as in how to fill our Oriel application, how to rank jobs, how to accept jobs, and what the different terms all mean, accepting with upgrades and more. So for the first part of the webinar, the Q&A, we have Dr. Katrina Turnbull. She's a plastics team, the CT1, working in Edinburgh. And she's also part of the educational subcommittee of UK Plastics Research Collaborative. So thank you so much for joining us, Kat. Myself and Faye will be able to give us the questions that the audience shares, and you decide how to answer them.
Fantastic. Thank you so much, Anna. Thank you for the lovely introduction. So hello, everybody. I'm Katrina. As Anna said, I'm a core trainee based in Edinburgh, and my rotations are plastics themes. So I'm doing breast ENT and breast ENT and plastics here in Edinburgh. And I'm hopping on the first kind of 30 minutes, half an hour of the session to effectively answer any questions that you might have for core surgical training, the application process, the job, anything at all. So if you've got any questions, feel free to put them in the chat, as Anna said, and we will just make our way through them. So I think the first question that we've got, someone said, do I need a CST rotation in a specialty to then apply for it for ST3? So I think if you know for sure what specialty you'd like to apply for, this makes your life significantly easier. But it's not the end of the world if you don't get a job in your desired specialty as a core trainee. Please goodness, I'll be applying for a plastics ST3 post as a core trainee next year. And the plastics pathway is very procedural based. So you'll have to get lots of things signed off in order to be able to have a competitive portfolio for ST3 applications. So from a plastics point of view, if you have a plastics job as a core trainee, it makes your life a lot easier. But lots of people don't get a job that they'd like or the specialty that they'd like in their core rotations, and that's okay too. It doesn't mean that you can't apply for your chosen rotation. It just depends on whether the subspecialty that you'd like to sort of pursue is procedural based or not. The other thing to think about if you're thinking about rotating and your jobs is where, if you do get a job in your chosen specialty, where it is with regards to what job it is in core training. So each job is split into 6 months. So I'm doing 4 lots of 6-month jobs, and you apply for your registrar job before your last core training rotation, so before your last 6-month job. So if, let's say you wanted to do breast surgery and your breast surgery job falls at the last rotation, you won't be able to get any of the procedures done because you would have already applied for ST3 posts. So that's something to think about as well. So another question, has anyone applied to the Northern Ireland? How does the selection process differ? I didn't apply to Northern Ireland, so I don't know if the selection process differs. I would imagine, from my understanding, it's all done through Oriel, and the process is pretty standard for whatever deanery you're applying for. So I would imagine it's probably the same. But I have to say I didn't apply to Northern Ireland, so I probably wouldn't be the best person to answer that. Any other questions?
Yes, we've had another question from the audience. How far in advance can we start recording cases in our e-logbook?
Great question. So effectively, the sooner the better. It doesn't matter if you haven't started already, but it'll make your life easier if you start as a student, as an FY. I started my logbook as a medical student and managed to get lots of things recorded before even starting as a foundation year doctor. I had lots of surgical jobs as an FY, but actually didn't really get any cutting time and any theatre time just because the busyness of the job. And you don't really go into theatre as a junior doctor or as a foundation doctor, I should say. Or I didn't anyway. So if you can start early, I think that just makes your life easier. And it also shows dedication to the specialty, which I think can look quite good for you, and from a portfolio point of view is always useful. So I think the sooner you get started, the better, but don't panic if you haven't started already. I've got friends who will be applying for core training, and they've only just started this year, and they've only just started getting their logbook sorted. And I think to get top points for this year, you need 40 cases, from my understanding. So if you give yourself maybe a couple of months to try and get all of those logged, that's a kind of doable. It's quite a big task, but it's a doable task. So the earlier the better, but if you haven't started, don't panic, and use the e-logbook kind of platform online. So the next question is, criteria changing every year. What things do you think are unlikely to change in the CST application scoring criteria? So the core training criteria have changed a lot over the past few years. I probably started very sort of gently started collating a portfolio as a student, and the criteria had changed a lot from when I started to when I applied last year. So I think things that are unlikely to change would be things like your logbook, because they like you to have recorded cases. The number of cases might fluctuate, but I think the logbook is a pretty sure thing that they will keep. It's obviously difficult to say for sure, but I would imagine that they would keep the logbook. And things like presentations and publications, I know sometimes these come in and come out, but I would imagine having things like posters and oral presentations will probably stay. I think publications, I don't know if they've now cut publications actually from this year or they've bunched it into the same group. But I would imagine your kind of standard presentations, attending courses or conferences and that sort of thing will stay. It's also useful to think about not just for core training, but also for your registrar applications as well, that even if they're not counted for core training, it's not time wasted and it's not time lost as such if it's not counted for CST things, because it may well be counted for ST3 applications as well. So don't fret if something like prizes was cut out of the application process a couple of years ago. And I think in some specialties prizes still count for registrar jobs. So don't fret if things are chopped out and you're not expecting it. It's not time wasted or time lost. So just to confirm, joint first author is counted for the publication grade A. I'm not sure. I think they'll be very prescriptive about what counts and what doesn't count, and there's going to be very little wriggle room with regards to sort of maybe trying to get something into a higher grade or not. If they say joint first author is counted, then they will allow it. But I think if it's not prescriptive and it doesn't say joint first author, then I might be a little bit cautious. The other thing to note is that when you apply, you give yourself a self-assessment score, and if they then disagree with the score that you've given, so let's say you give yourself, I'm picking numbers out of thin air, let's say you give yourself 10 points and they think actually we only think you get 8 points, you might land yourself in hot water, because if you overscore yourself, you can run into problems there. So it's very, very you have to be very, very careful when it comes to scoring yourself and looking at the self-assessment. So I think if they say joint first author is counted for a grade A, then that will be the case. But if it's not prescriptive like that, I'd be cautious.
Just to follow up from I'm applying this year, so I don't have first-hand experience, but I do see that on the on the portfolio criteria, they have a bit about joint authors.
Okay.
So you can definitely read that, guys. But at the same time, there is also a platform where you ask a question and they are able to get back to you.
Yep.
They got back to me within a day. So if you have any doubt whatsoever, you can sort of write about your evidence there and they would confirm for you, which I definitely recommend from that point of view, because this is a very personal case.
Yeah. So the next question is it still worth doing a PG cert, considering it's cut out of this year's application and maybe in the future as well? I think doing these extra things always has pros and cons. I think currently for registrar jobs, I think a PG cert is counted, or at least for plastics, I would be more familiar with that. It also gives you the time to do other things if you want to. Doing something like a PG cert, so maybe you could work on getting some presentations or publications, or I know some colleagues have done a PG cert and then managed to increase their logbook and their surgical experience. So I think it's important not to do these things just for the certificate. I know it's very tempting sometimes, particularly if we're needing to kind of increase our points and, you know, we want to better our portfolio. But I think making sure that we do it for the other reasons as well as just the kind of portfolio side of things is important. I did a master's, which I think now, I'm not entirely sure, but I'm not sure if it's going to be counted for registrar jobs. But doing the master's allowed me to do some publications and lots of posters and all of that sort of thing. And that has been incredibly valuable. So whilst I might not get the certificate for the extra degree, I was able to do lots of other things, which has been really kind of beneficial, not just as a trainee, but also for portfolios. So I think if you want to, you have the time and you want to take some time out and that sort of thing, I would encourage it. But I think it's important to acknowledge that we do these things for the right reasons, as opposed to just doing it for the sort of certificate, if you like. So do you think taking a year out to do teaching on F3 to prepare for core training is a good idea? I think it's a very good idea if you want to. I didn't take an F3 year. I went straight from FY2 to core training. I wanted to go straight into core training if I could, because it can be quite a competitive process, particularly if you're specific about where you want to work and the jobs that you'd like. So I sort of took the frame of mind that I would give it a go, and if I got a job, great, and if I needed to take some time out, that's okay too. But equally, I think there's no rush, and we learn a lot by doing other things and, you know, going away if you want to do some traveling, seeing the world, do some academic work, do some research, or get maybe like a clinical fellow job to improve your portfolio and then apply for core training. These things are all valuable and worthy. I think the only thing to think about is that, again, I can't speak for other specialties, but I know for plastics, if you've taken more than a certain number of years out of training since you graduated, you then get penalised quite heavily for your points for your registrar jobs, for your registrar application. So that is potentially something to think about. But I think there's a couple of years of wiggle room. So I think if you want to take a year out and do an FY3 or do a clinical fellow or do an extra degree and that sort of thing, is a very valuable thing to do. We learn a lot both within medicine and outside of medicine, and I would definitely support it, which is ironic because I didn't take an F3, but I think it can be a really good idea. And it's also something to talk about at interview as well, which can sometimes make you stand out from your peers. Yeah. So the next question is, how does one organise a taster week in foundation training? So I think it probably varies deanery to deanery. I organised a couple of taster weeks, and the way I did it was as a foundation doctor. I'm not sure if you're FYs or medical students or who's in the audience. So as an FY, you get allocated an educational supervisor, and a lot of these things need to be organised through them. But the way I organised a foundation, a taster week was emailing the consultant of the chosen specialty that I wanted to spend some time with, and asking if I could join them for a taster week and what maybe would be an appropriate week to join them. And then if you sort of get all the information and do all the legwork yourself, and then you can present the idea that you're going to take a taster week, between this date and this date, give the rota team plenty of notice, then it makes it more likely that you'll be able to get your chosen week in your chosen specialty. But I organise everything through my educational supervisor. So the next question is, could you tell us about your experience sitting the MSRA? How long is the exam and what did you find hardest preparing for it? Sure. So the MSRA, as I'm sure you'll all be aware, is now quite a significant part of core training applications. You have to prepare for the exam and then sit it. And then depending on when I did it last year, you had to get a score that was higher than the cutoff score to get an interview. I think, and your portfolio was also included in that. I think now it's just done on your MSRA score. So the score is really important. There are lots of different sort of lots of different types of advice online about sitting the MSRA. I probably studied from about now, really, so kind of October time, and I sat it at the beginning of January. I think I sat it in one of the last dates, so I probably did a good kind of 2 months of revision, and I used past medicine, and I also used a kind of a question bank called eMedica, because they had lots of different past papers, if you like. I thought it was quite similar to finals in terms of the breadth of knowledge that you needed. A lot of people, or all GP trainees, or all people applying to GP training have to sit the MSRA. So it's very much focused on a breadth of knowledge. And it's split into both a clinical section, so like science-based questions, and then a kind of SJT type thing. And I found the SJT aspect of the exam very similar to the actual SJT that I sat as a student. I think the hardest thing was knowing roughly where your knowledge level needed to be. I think I probably presumed it needed to be quite a lot more in depth than it actually was. But then probably some things I maybe didn't quite get the mark right when it came to the breadth of knowledge that you need. So I would take a focus of trying to know a reasonable about lots of different things, as opposed to an awful lot about everything, and then naturally you then can't cover everything. I think timing can be quite difficult, so you can be quite short on time, particularly if you flag questions and then you need to go back to them, or you're not sure, and then you kind of sit there and think about it for a minute or two. So I think timing, it's all about practice, and kind of nailing that from that side of things. And then I think it's all about practice when it comes to the SJT and the ethical side of questions. So I just did lots and lots of past papers and question banks. And whilst it's kind of difficult to know where you should be, because, you haven't sat I hadn't sat the exam before, so I wasn't entirely sure what to expect. About 2 months worth of revision, quite kind of good going revision, lots of past papers and past questions, I think prepared me relatively well. What would you recommend sitting MRCS? Would you recommend sitting MRCS Part A and Part B in foundation training, and does it matter? So you can sit the MRCS anytime from when you graduate. So you can sit it as an FY. There are pros and cons to sitting it in foundation years and then sitting it as a core trainee. I think the benefit of sitting it as a foundation doctor is that if your jobs are maybe a bit more amenable to studying, then you can kind of get an awful lot of studying done during foundation years if you want to, and then it takes quite a significant job off your to-do list as a core trainee. But I think what you're studying, what you're learning for the MRCS is actually incredibly relevant as a core trainee, particularly if you've got lots of kind of slightly more broader jobs, or if you're doing things like general surgery, orthopedics, that kind of thing. The anatomy and the physiology and the surgical side of things is very relevant. So it's almost quite nice to be able to utilize the knowledge that you're learning when you're prepping for the MRCS as a core trainee, as opposed to just having it as a foundation year. And then, I don't know, I can only speak for myself, but if I'm sort of cramming for an exam, I remember most of it for the exam, and then quite a lot sort of leaves my head after a few weeks. Whereas the knowledge you need for the MRCS actually you'll need throughout your training. Part A and Part B, I'm sure you're probably aware already, but the MRCS is split into Part A and Part B. Part A is the written papers. That you get 2 papers and it takes about a day. And then Part B is like the clinical OSCE side of things. I don't know of anyone who sat both Part A and Part B as a foundation year. I know a few people who've done Part A, and I think from their point of view, because they don't have to worry about it as a core trainee, it makes their life a lot easier. But then I think when you're training as a core trainee, you kind of naturally get exposed to probably the level of knowledge that you need, and things like for the anatomy, you're seeing the anatomy in theatre, and it kind of makes it a lot more relevant and that sort of thing. So perhaps it's maybe a little bit easier to study for as a core trainee. So I think if you can sit it as a foundation doctor, you've got the time. You can always give it a go. I don't think there's anything wrong with that, but don't stress if you feel like you can't manage to sit it in foundation years. That would be my advice anyway. So the next question, between the time you get an offer and the start of courting, how did you prepare? Did you purchase anything in particular, like surgical loops or anything else? So you get your offer. I got my offer during my last job, I think, of FY2. And with regards to preparing, I didn't really do very much, actually. I practiced my suturing because I thought I'd like to turn up on the first day and have a rough idea of how to kind of simply close a skin wound. But I didn't purchase any sort of specific equipment. So I didn't purchase any loops or go on any courses before starting core training. I think from when I've spoken to my supervisors and my consultants as a CT1, they very much expect their core trainees who are doing their first job to effectively not really know very much at all, and they mean that in the nicest way. And it's actually really helpful because they expect you to start from scratch, and they want you to learn the basics in a really good way. So at least my consultants and my supervisors didn't expect me to know everything from when I started in day one. So I didn't really need to do an awful lot in order to prepare. I think I probably brushed up on a little bit of anatomy and practiced my suturing. But apart from that, didn't. And I did look at consent, actually, how to consent patients and that sort of thing. But I didn't do an awful lot in terms of preparing before I started core training. So the next question, do you need the basic surgical skills course from the Royal College of England for core training? So I don't think you do. I think if you can do it, it's very good. And it gives you a lot of information over quite a short period of time. But it's not, from my understanding, I don't think it's mandatory. You've got a few mandatory courses that you have to do as part of core training. So these are things like ATLS and CRISP and some other similar courses. CRISP is care of the critically unwell surgical patient. But I don't think BSS is mandatory for core training. But if you have the opportunity to do it, it's a very good way of sort of learning the basics, practicing, and they've got quite a high sort of delegate to tutor ratio. So it is a very valuable thing to do if you can do it, but I don't think you have to for core training. So the next question is for CRISP and ATLS. Do you pay for it, or does the deanery pay for it? So I don't know if it might vary deanery on deanery. I'm based in the southeast of Scotland, and for me, I get ATLS and CRISP or its equivalent funded. They're quite expensive. Well, they're very expensive. ATLS is just under £800, and then CRISP is about the same. And I get these funded. I think you get, so ATLS is a bit like if you've done ALS or BLS, you have the course, you have some mandatory MCQs that you have to do before the course, and then there's like a kind of exam on the day that you have to pass. And I think if you fail the exam on the day, you can have another attempt. But if you effectively fail the exam and need to sit ATLS again, I don't think they'll pay for you to do it again. But I think they'll cover it once, definitely. So it'll be funded. But then I think you have to cover your own sort of travel costs and if you're staying over and that sort of thing. So the next question is, what was the most difficult aspect of the interviews? How did you prepare? So the interview, I think the most difficult thing I found about the interview was the time. So you've got a set number of minutes per station, and it's almost like, I would imagine they have a tick sheet, and you need to get through as many of the kind of points on the piece of paper in order to scoop up as many of the marks. So you have to get through as much as you can. So I found the timing of that quite a challenge, and you have to be incredibly slick at recalling your A to E and what you do and what you do next, and have things that sort of slip off the tongue, like referring back to care of the critically unwell surgical patient, or guidelines, maybe, if you're managing someone with a nasty femoral fracture, having the orthopedic guidelines and that sort of thing. So the timing and knowing what to say, or the sort of buzzwords in order to get you the points, I found challenging, in the sense that you just needed to practice this and learn this. For the preparation, I had a couple of books that I prepared, that I used for preparation, and then I also subscribed to an online system. I can't remember it off the top of my head, but I'll let Faye know, and perhaps we can email you all if you'd like to know, where they give you scenarios, and they then give you kind of the perfect answer, if you like. And I found that really helpful. And then the last thing I did, probably for the last few weeks before I got the interview, was practicing with other people. So if you've got medic friends, probably they're super helpful in these situations, or equally non-medic friends, just to kind of put you through your paces and press the clock when they say go and you have to answer the questions, and just allows you to very much verbalize what's going on in your head and get it out in sort of exam perfect answer format. That was invaluable. So practice with other people if you can, just kind of going through your very much standard answers, because the questions were probably, or what I found was, when I was doing the practice questions and then what I got in interview, they're actually relatively similar. They're pretty prescriptive. So just having that in your brain that you can kind of fall back on, and you almost don't need to think about, what you do next in your A2E assessment, is invaluable. So I used a couple of resources, but practice as much as you can. And I also attended a couple of webinars, and then had like a draft, not a draft, a kind of mock CT interview, and you got feedback, and it was very constructive, and I also found that really, really useful. So if you've got the option to kind of practice with seniors who've maybe been there and done that quite recently, I would advise that too. So one more question. Okay, we'll take one more question. Do we have one more question?
I currently can't see one more question in the chat, but if anyone from the audience would like to send one more question, please feel free. Otherwise, we got through a lot, and if no one has anything else to ask, there is one more question. Should interviews be practiced after getting shortlisted with IMSRA marks, or earlier?
So I think this is really difficult. I initially didn't practice interviews. I was very much of the thought process of, I'll wait to see what my MSRA mark would be, and then if I'm lucky enough to get an interview, I'll then start preparing. But actually the window is quite small, and I was told by a senior very much to be like, give it a go, practice for your interview, and just kind of move forward as if you know almost that you're going to get an interview. And I think giving yourself that wriggle room and that extra time to prepare is really useful. So I would suggest focusing, because I appreciate now the MSRA is really important with regards to getting an interview or getting shortlisted. Focus on the MSRA, but then don't leave it until you get your MSRA mark to then start interview preparation. And it's also your interview preparation, because you ask clinical questions too in the interview. So that knowledge that you'll need to have on the tip of your tongue for your interviews will also be helpful for the MSRA. So I wouldn't leave it until you've got your MSRA mark to start preparing for an interview. I'd do it concurrently. That would be my advice. Great.
Sounds good. Thank you so much, Katrina.
You're very welcome.
We've really picked your brains inside
Not
out.
at all.
We've asked you so many things, and it's been really, really helpful, honestly, as a prospective applicant.
Great.
So we'll now just invite Fran to the stage. But for everyone in the audience, please remember that through MedAll you can always start a discussion thread. And if Kat today has said something that then you find yourself reflecting in a few days, you can always write it either on the MedAll app or on our social media channels, and we'll find someone from the committee ready to answer your questions. So thank you so much, Katrina, again, and thank you so much everyone for engaging for the first part.
Hello everyone. Please just let me know that you can see and hear me, because this is my first time doing a presentation on MedAll, so I just want to check that everything is working. And then I will share my screen.
Fran, we can see and hear you very well.
Excellent, perfect. So I'm just going to share my screen. Give me 1 second. Can you guys see that?
Yeah.
Perfect. Okay. So hi everyone, nice to meet you. My name's Fran. I'm a CT2 in plastic surgery currently at Coventry Hospital, and I'm going to be talking to you today about preferencing for CST in 2024-2025 application round. Bit of a disclaimer. So this is now 2 years since I applied for CST. I have gone through the guidance for your year, but one thing I'll say throughout the presentation regularly is that it's super, super important while you're going through the application process to keep referring to the guidance. And obviously we all know that the Oriel guidance and the guidance online is sometimes feels like it's a bit all over the place and is very wordy. But really that is the biggest way that you can kind of mess up your application if you don't keep referring to that. So that's something that we'll keep repeating throughout the presentation, but is really, really important. In this talk, we're going to go through an overview of the preferencing process. We'll go through the key timeline. We'll go through quickly the practical steps to preferencing and how you actually do that on Oriel. However, this again is something that you'll probably completely forget when it comes to the preferencing process, but is relatively straightforward and easy to work out. The main kind of part of this talk is going to be talking about ranking posts and then going through some kind of tips and tricks in terms of ranking your rotations to try and make sure that you get the rotations that you want. And basically things I wish I knew at your stage when I was applying, because I think it would have massively altered my decision-making in terms of ranking. Finally, we're going to go through some of the terminology about accepting and holding offers, which can be really confusing. But again, I think this is something where we'll go through it. You might forget it, but it's just the key point there is just to really make sure that you go through the guidance and understand when you're responding to an offer what you're actually kind of committing to and what you need to then commit to by a different deadline. Very quickly, we'll go through the application timeline. So currently we're in the stage of the application window, which is between the 24th of October and the 21st of November. You'll then have your MRSA window. The dates of that are not yet confirmed, but that's likely to be somewhere between December and January 2025. You'll then have a period of evidence submission. So that will be between the 7th of Feb and the 19th of Feb. And then you'll have your interview window, which is between the 24th of Feb and the 7th of March. The preferencing window is between the 1st of February and the 4th of March. And this corresponds with obviously probably the most stressful part of your application, and is something that's very easy to kind of put on a back burner while you're preparing for interviews, sorting out your evidence, obviously working full time alongside it. But it's a really, really important part of the application and something that you shouldn't leave to the last minute. So make sure that you're aware of the initial preferencing window, which will be between the 1st of Feb and 4th of March. And that, again, will happen right at the most stressful period of your application, which is when you're uploading evidence and when you're trying to prepare for your interviews. You then have, following the interviews, if you're successful, you'll have your initial offers. And then there are 2 other deadlines, which we'll go through in more detail. And in this phase, you'll go through a stage of re-preferencing or upgrade cycling, and we'll talk about that a bit later in the talk. So you will have some opportunity to preference between 25th of March and 8th of April. But to be honest, it's best if you get it right first time. The job choices at this stage will be limited. Preferencing can be a very complicated, overwhelming and challenging process, but has a massive impact on your satisfaction in core training. So making sure that you know the key dates in the timeline and understand all of the terminology is really crucial. So this is based on last year. So last year there were 645 posts in the UK. I've kind of split that up into different regions on this map. I'm sorry to everyone from Scotland and Wales because I couldn't actually find a map with the correct deaneries for core training on. But Scotland had 60 posts and Wales had 43. There are generally around 600 posts to preference, which when you initially see that spreadsheet of jobs right in the middle of your interviews makes you feel incredibly stressed out. But don't worry, it is quite a straightforward process once you get a hang of it and you kind of develop a system around it, and we'll talk through that slightly later. So the basic overview of how you actually preference. So you'll get a notification when preferencing opens, and this is in the form of an email from Oriel reminding you that the date for preferencing has opened, and you'll be able to see the preferences on the Oriel website. The first thing you're going to need to do is log into Oriel, and you'll have to navigate to the preferences section on the CST application profile. So on your dashboard, it will look something like this, and you just click on the preferences button here. Once you've done that, you will come to essentially a page that has something like this on it, and you'll be able to see preferences in one column, jobs that aren't wanted in another column. One thing that's slightly confusing is that for some programs, there is an additional column. That's a new thing that seems to have been added since I did this. But I think for core training, it's likely to be something like this. So it's likely to be laid out like this. I know obviously these are IMT jobs, but this is the only template that I could find on Google Images. The most important thing to do at this point is basically to download the jobs into an Excel file, because this is where you're going to be doing the majority of your preferencing. So you'll download it into Excel, and you'll open your preferences in Excel. You'll see the 600 jobs and in a big table with loads of information. And essentially it will look something like this. So this is from the year that I applied. Obviously, this is a column that I've added, but essentially you'll have the preferences listed here, and then you'll have a description of the program giving you an outline of what jobs, which hospitals, and here you'll be able to see which region the jobs will be present in. So you can kind of use this to kind of start your process of trying to rank. Once you've ranked your jobs on Excel, which does take quite a long period of time and deliberation, and will also require you to kind of keep returning to it, keep going through it, do a little bit every day, speak to people you care about, especially about the top section of your ranked jobs, and that will allow you to kind of make decisions. And then basically you take your Excel sheet and you put that into the column here. So you will upload in your search for the job here, and each job will have a number associated with it, or like a code associated with it. So you search that in this bar here, and then you add that to your ranking. So you can essentially copy this into here, and that's the basics of it. There is, in the not wanted column, you can add any jobs that you wouldn't accept or you definitely don't want. I think in terms of your timeline, when I applied, you knew your ranking at the time that you preferenced your jobs, which was quite helpful because you had a good idea of how many jobs you needed to preference to be guaranteed a job. I'm not sure if that's the case for you guys, because if we go back to the timeline, which we will do in a second, it looks like your initial offers are after interview and your initial preferencing is closed by that point. So I would advise that you rank a large number of jobs, obviously nothing that you definitely wouldn't want to do, but make sure you rank enough jobs so you're not in a situation where you're not given an offer on offer day. Because there is always the option later on in the preferencing process to be able to upgrade your offer. So you want to make sure that you have a job to start with that you can then kind of opt into upgrade cycles with. If it's not necessarily what you want initially, that's not the end of the world. Things do change. So that's kind of an overview of how to preference. One thing I'll say is that I would speak to other people that are applying at the same time. Make sure that you're all doing it correctly. Make sure you're reading the guidance. There are some key steps in the guidance that are really helpful. Things like making sure you save your preferences every time, making sure you tick the box to say that you have reviewed all of the preferencing options every time. They're things that are really easy to miss. And obviously, you can get to a point where you think you've submitted your preferences and you actually haven't. So make sure that you check and make sure that you follow the guidance on Oriel while you're doing this process, because it is boring to read through, but at the end of the day, it makes a massive difference. And it's really difficult to kind of get in contact with the recruitment office at the last minute and be sending frantic emails asking them kind of, I thought I'd preference this and I haven't, and the deadline's passed. You don't want to be in that situation. So just make sure you read the guidance while you're doing this. And I would also say, and this is slightly off topic, make sure you do that with your CST evidence as well. Make sure that every single thing you're uploading, you have exactly what they have asked for in the words that they have asked for. So you're not in a situation where they're docking points, because they are they can be really strict on the rules when it comes to that. And it's just something that you can completely avoid if you're organized and you follow the guidance properly. When you think about how to preference, so this is really the main part of this talk, there are several things that you're going to consider when you preference your jobs. And they're different for every person, but I think in general, most people will think about which rotations or which jobs they want, which region they'd like to live in, which hospitals they might want to work in, and which opportunities. So when you think about DGH hospitals, they sometimes are better in terms of theatre experience, whereas teaching hospitals can be, and this is a massive generalization, but teaching hospitals can be more difficult to get theatre experience, but are better in terms of research opportunities. But then also thinking about opportunities outside of work. So think about the things you like doing, whether you're going to be able to do them in the place you're considering moving to. And I think that's really, really important, because to be honest, you need to make sure you're happy for the next 2 years. If you're not happy, you're not going to perform as well at work, and you're going to end up in a situation where you feel really stressed and burnt out. The 4 kind of tips I would give you in terms of thinking about preferencing are: understand all of the jobs and rotations available. Make sure you've read through the whole sheet and you've systematically worked through all the jobs. I would come up with a system that's going to be different for everyone, but we'll go through my system after this. But come up with your own system to help you prioritize based on what things are most important to you. Take into account factors which are important to you, not only at work, but also in your everyday life and things you enjoy doing and what makes you happy. And really put yourself in the situation, especially with the top kind of 100 at least of your jobs, of how you would feel on offer day if you were given that job. That's something that I think is really easy to do when you have 645 options. It's really easy to think, oh, I'll move to the other side of the country to do this rotation because it has all of the jobs I want. And then suddenly you're in a situation where you are moving away from your friends and family. You don't know where you're going to live. You're feeling stressed out. You don't know anyone that's working there. So really try to put yourself in the situation of how you would feel if you were given that job on offer day. Human beings are quite complicated, so this isn't necessarily the only 4 things you need to think about. There are going to be other things that are more important to each individual, and that's totally fine. It's just about really thinking about, during core training, what are the things you want to achieve? Where do you want to live? Are you close to your friends and family? Are you well supported? Are you going to be happy? Are you going to be able to get out of core training what you want? And I think just really thinking about your priorities for core training is a really good step in terms of then doing your preferencing, and really, really important. I've put this figure here. I don't know if anyone knows what this is. I'll give the audience a second to respond if anyone has seen this before. Or I'll just continue with the deafening silence. This is a figure that's called Maslow's hierarchy of needs. So this is essentially a pyramid that demonstrates what human beings need to be able to reach kind of their full potential, and their like best self and their best, like, you know, your best efforts at work and how you're going to kind of be the best person you can be. And actually it's underpinned by all of these other needs. And these are things, I think, especially in the medical profession, that we often put on a back burner. We often do 13-hour shifts without eating and drinking properly. We often sacrifice kind of weekends and time out to make sure that we kind of achieve different things on our portfolios. But actually, 2 years is a really long time if you're unhappy. And I think it's very, very important to make sure that you are prioritizing your family, your friends, your loved ones, when you're undertaking this process. So I'm going to break these down into kind of each section. So when thinking about which jobs, I would start by thinking about what you need for ST3. My top tip in this kind of area is, if you're split between 2 specialties, I would focus on your top specialty for ST3, and I would make sure that you get as much experience in that as early as you can, rather than splitting your different options between different rotations. I think it's very, very hard if you're trying to do everything to meet the requirements for different specialties, especially if your chosen specialty is something that's very competitive. I would try to get early jobs in that specialty so that you have built the connections and you've got the cases that you need to be able to apply for ST3 in the November of CT2. And one of the mistakes I made was to put all of the plastics jobs that I wanted late on in my core training. And that makes it really stressful and difficult to make sure that you have your numbers for ST3 at the point that you are applying. So I would try and prioritize your top specialty for ST3, and I would try to maximize the amount of time in that specialty in CT1 rather than CT2, which is kind of counterintuitive because you think I will have developed the surgical skills by CT2 to be a lot better in that specialty. I would just go for it as early as you can. Don't rely on swaps throughout your rotations. Swaps are possible in most deaneries, but you can't really rely that you're going to be able to swap into a specialty, especially if it is a competitive specialty. And it's also difficult to know where that job will be and if it will be in a geographically kind of convenient place for you to be able to commute. The other kind of key point to add to that is you usually can't swap out of your first rotation in CT1. So I would try to make sure that your first rotation in CT1 is something that is going to be beneficial to your career. Obviously, all 4 of your core training jobs or all of your core training rotations usually aren't going to be the same specialty. There will be a bit of chopping and changing and doing different specialties, but try and think about when you'd like to sit your MRCS exams if you haven't already, and kind of make the most out of that rotation in a different way if it's not necessarily counted towards in your core procedures. The other thing to think about is that if you have made that contact early on with the top specialty that you're aiming for, that department in your hospital, it makes it easier to then go back and do locums or go in on weekends to do weekend lists or kind of, make connections that then allow you to do research in that rotation. It just gives you more time. So those would be my top tips in terms of jobs. The other thing I would say is going back to the point about how the initial preferencing window opens right at the point that you're most stressed out during your application period and you're trying to prep for interviews. And it's really, really easy to just think, I can't cope with preferencing 640 jobs. I'm going to, do it very roughly and hope that it all works out. If you rely on re-preferencing, especially for really competitive specialties, it makes it more difficult to then get those jobs later on. So I would just aim to start your preferencing early, make sure you've got your jobs in the correct order, give yourself the best chance of getting the jobs that you want. There are specialties where the upgrade cycles work really well and you might move up kind of loads of points up from where you were initially. But I think especially for those competitive specialties, especially for London posts, re-preferencing can be very disappointing. And I think it's important to know that early on and make sure that you do it properly the first time. Sorry, just before I move on, does anyone have any questions about that part?
I don't think anyone has written anything in the chat.
Perfect, thank you. Okay, so now we're going to talk about which region. So the CST deaneries are different to the foundation deaneries, and I think understanding geographically the size of the deanery that you are going to be working in is really important, because you might not always know the CT2 jobs of the rotation. So some core training programs don't actually list all of the CT2 jobs, or at least they didn't when I applied. So for example, Thames Valley, that you might be on a plastics theme, but they might not tell you in CT2 what your jobs actually will be. So you need to think about the size of the deanery, whether you're going to have to relocate during the middle of your training, which I think is always something to factor in. Thinking about obviously who you're living with, where you're living, your commute to work, because all of those things are going to have a really big impact on you when you're working a really busy, full on-call rota and trying to achieve all these things in your free time. Again, and I'm sorry I've said this so many times, but I would really, really prioritize your support system. I think it's really important to choose places where you have some support as your initial preferences. At the end of the day, there are pros and cons of every deanery. If you want the opportunities, you will find them. And I think having support kind of massively trumps that, because core training can be really, really hard. And it's especially difficult if you're then trying to factor in driving kind of the other side of the country or getting a train the other side of the country every weekend to try and make sure you have some social connection. So I would really prioritize being close to friends and family and making sure that you understand exactly where you might be working and how far your commute will be, because all of those things are going to really impact your ability to keep going throughout what is a really stressful kind of 2 years. It's not always possible to get your first choice region. So, obviously London is incredibly popular, but you can consider commuting to nearby deaneries, or you can consider transport links if you live on the edge of a deanery. But again, that's why it's really important when you're looking at rotations, especially if they tell you all the hospitals, to actually understand how far away is one side of this deanery to the other, where is my teaching likely to be, how frequently am I going to have to commute, how far, because all of those things are really important in understanding how your life is going to be for the next 2 years. Which hospitals and opportunities? So I would say once you've kind of narrowed it down to a deanery and you're going through the jobs in that deanery, I would try and get a feel for which hospitals are the hospitals where you would like to work. And again, we've spoken about the difference between DGH hospitals and university hospitals. But looking at the GMC survey feedback, so that gives you a really good idea of how trainees are reporting their experience in different departments. CQC reports give you a good idea of, again, different departments within the hospital. There used to be a really useful website called juniordoctors.co.uk where people would anonymously rate hospitals and leave comments, and that was really, really helpful. I think that now has been taken down, but there are still some links on Reddit which go through different kind of hospitals and people's different experience of working in different hospitals. The biggest thing I would say is that if you know anyone who works in the department or works in the hospital that you would like to work in, having a conversation with someone who actually works there either currently or has recently worked there is really helpful, because things can change really quickly. There can be massive shifts in rotas or systems within the hospital that can very, very quickly alter training. So kind of getting an up-to-date feel for how working in that particular hospital is, what the training opportunities are, is a very useful way of thinking about the different hospitals in the region, and then thinking about how long you're going to be working in each hospital and how that all works. One thing that I would say is crucial, and I know is not really in the nature of a lot of people, including myself, but it's something that I've learned throughout core training, is that when you get to CST, if there are issues with your training, if you're not getting enough theatre time, if you're constantly being asked to kind of cover the ward because your colleague's sick, make sure you flag those issues early, and make sure you flag that with your educational supervisor and the TPD, because at the end of the day, you are there to train, you're there to train to become a surgeon, and they need to give you the opportunities to be able to do that. They get funding to be able to do that. So I would say if you have any issues with your training, it's really, really important that you flag that early. This is my personal system. So this completely might be different for every single individual. And the point of this slide is not to tell you this is exactly how you should preference. The purpose of this slide is to kind of talk you through how I would develop my personal system based on what I would prioritize if I was to apply for core training again. Again, it's really important to kind of think about what your own priorities are. So my personal system would be to, if I was going to do this again, I would firstly rule out posts without plastic surgery because that's a specialty I want to do. I would then identify the regions I would be happy to work in. So for me, that would be West Midlands or that would be London, because those are the two places that my friends and family are. I would then identify jobs with 12 months in plastics, and I would prioritize jobs with plastics within CT1 rather than CT2 if given the opportunity, but I would rank all of those jobs. I would then look up the hospitals in the region and get a feeling for different centres, how the training is. I would try to speak to people in different hospitals, and then I would form a system to rank jobs. So there's no right or wrong way of forming that system. I personally chose to do that based on points. So I allocated different points based on how I prioritized these different things. The things that were an absolute no-go for me, so posts which didn't have plastic surgery, I didn't rank because I didn't want to do any other specialty. But I know that for some people, just getting a job and then being in the situation of being able to do upgrades, it is useful to also rank those jobs, because there is a chance at a later point you might get offered something that you weren't initially kind of expecting. So I would color code regions and jobs. That's because I love Excel, but I love highlighting things in different colors. I just think it makes it easier to understand. I would also create a new sheet at each of these stages, and I would try out different things. So if you find that once you've ruled out posts without plastic surgery, there's not enough jobs for you to rank, you can go back a step and kind of add in other posts that you might be interested in. You might add in, I don't know, posts with TNO as a second choice or something like that. I would make sure you preference enough jobs. And again, I think that's harder for you guys because you might not necessarily know your ranking at the point that you are trying to rank your jobs. But just make sure you have gone through that stage, because you might get lucky. And even if you don't get your first choice, there is a chance that you might get that at a later stage. And I would start early. So I left my preferencing, I think I left it till the last week, thinking I had plenty of time to rank this number of jobs. And I managed to do it, but it was incredibly stressful. And I wish that I had started earlier, because to be honest, it's going to take you the same amount of time either way. It's better that you do it properly. It just relieves that anxiety of, did I do the right thing? Should I have spent more time preferencing? You just don't want to be that person. So I would start as soon as the preferencing window, because the closer it gets to interviews, the more stressed you're going to be and the less you're going to want to do your preferencing. And it also gives you a chance to kind of talk things through, reflect on things, think about, actually, I've decided that I want to be with my partner who lives the other side of the country. So I've decided to change everything, and I've had a conversation with my parents or with my friends, and I've managed to work out what I want to do. So I would just start early, give yourself time, make sure that you have time to think and reflect on the jobs that you're submitting. Getting an offer, and sorry, just before I move on, any questions about any of that? We can go through everything at the end, but
yes.
Okay.
There have been 2 questions.
Okay.
I don't know why my voice is echoing. Okay, not echoing anymore. Okay, so the first question would be, what would be the adequate number of preferences roughly? And I think you mentioned that, of course, in your year it was different because you knew your ranking already.
Yeah.
So I'm not sure if you could elaborate on that.
So I think it really depends. I mean, to be honest, if you rank all of the jobs, you're not going to be in a situation where if you rank all of the jobs, you're not going to be in a situation where you could have got an offer, but you didn't take it and you haven't opened yourself up to the possibility of upgrades. So I think what I would do in that, I think I would probably rank as many as I could, but I would focus on ranking properly the ones that you really, really want. And then following that, I would try and find a way of kind of maybe shortlisting. Like, to be honest, the more effort you put into this, the better job you're going to get. But whether it is possible to kind of sit down and actually rank 645 jobs, including jobs that you would never ever want, is another question. It does get quite difficult. So what I did was I ranked all of the jobs with plastics across the country, and I did that section of my application very, very thoroughly. I then block ranked jobs. So I kind of said, okay, TNO in a TNO themed rotation in a deanery that I wouldn't necessarily want to work in. I'll just add those jobs, and I might not necessarily spend so much time kind of going through them and making sure that they're checking all the hospitals and things like that. So I would prioritize the time you spend on the initial ranking section of it, going through I would say at least half of the jobs properly and making sure that you have ranked them correctly. The ones that you don't want as much and that you're kind of just putting in because you want to have a hand in the game if it comes to being able to increase your offer with upgrades, I would spend less time on, but there is always a chance that you will be offered one of those jobs. So I mean, it really is kind of down to how confident you feel about your interview, what you would be willing to accept, how many specialties you would genuinely consider at ST3, because I kind of knew that really the only thing I would consider was plastics at that point. And making sure that you know, if you're not going to take the bottom 100 jobs anyway that you've ranked, you absolutely wouldn't accept any of them, but you just want to have a hand in the game. It doesn't really matter where you've put them, if that makes sense.
That makes sense. And I think just for our knowledge, roughly how many plastics themed jobs, if you remember, were there in your year?
I can check at the end of this because I think I still have the Excel sheet. So at the end of this talk, I'll stop sharing my screen and I'll see if I can find the Excel sheet and give you a number.
Thank you. That sounds really great. And the next question, I think you will be going into it soon anyway. Melissa is asking, potentially you can preference everything and then be likely guaranteed a job and then upgraded to a job you wanted higher up.
So we're going to talk about upgrades. I would say, so you're more likely to be offered a job, but just so that you guys all know, there are 645 jobs. Sorry, I'm now going, one second. I'm now going back through all of these. So there are 645 jobs, but actually if you look at the number of applicants per post in each application year, in 2022, there was 2,302 applicants, and last year there was 3,384 applicants for 645 posts. So it isn't a guarantee at any point, but obviously if you get the 645th post you would have wanted, you still have a situation where you're able to kind of upgrade your offer. I think there is still a reserve list, and if I'm completely honest with you, I'm not exactly sure how the reserve list works. That's something that is on the Oriel guidance, but kind of ranking 645 posts gives you a better possibility of getting one of the jobs out of these 3,384 people who are applying. The other thing I would say is that if this is and obviously have a think about it, but if this is the first time you're applying and you don't necessarily get what you would want, or you don't think that you would be happy in that post, I would really, really consider whether it's the right thing to do to go ahead with 2 years of rotations that you definitely don't want to do for ST3. I think having a year out will make your application stronger and will give you time to focus on the interview, focus on what you got wrong in the first round, really think about your options, do your exams. And I took an F3 and I didn't actually apply in the cycle of F2 because I didn't want to have the stress of getting a post and not being sure I wanted to take it. But I think having a year out, actually, I was in such a stronger position the following year than I would have been if I had applied in F2, because of the fact that just that extra year of knowledge really, really helps you ground your application, think about what you're lacking, get the things done that you haven't done the year before, and then you can make that a really, really productive year. So I wouldn't be afraid of having to take a year out, even though I know it's getting more and more competitive every year and it is very, very stressful. And I'm sure you guys are all feeling really stressed about it, but don't be kind of forced into taking something that you wouldn't be happy with, because at the end of the day, if you don't want to do it at ST3, what are you working towards? It's not going to make you happy in the long run. So I would, if it was me, and obviously everyone is different, I would consider taking a year out if it's your first time, especially. Get your exams done, do something that you're interested in, build your portfolio for the following year, and then come back in a much stronger position to reapply and potentially get the job that you want. Not everyone gets it on the first time, and it is a hard process to go through. Have we finished the question?
Yeah, we have finished the questions.
Okay, sorry, I'm going to go back to my other slide, but my computer's frozen, which is great. One sec. Okay. Where were we? Okay. Right. We're going to now go through getting an offer and re-preferencing. So again, read the guidance. Make sure you understand the terminology. So I don't know who came up with this terminology on Oriel. It's so confusing and it catches people out all the time. And I have worked with people who have got this wrong and have lost the offer that, they were going to accept because they didn't understand the terminology properly and hadn't read the guidance. So this is the point at which, unfortunately, some person has made this terminology which is incredibly similar and difficult to understand, but you really, really need, I would say, read it every time that there's a re-upgrade cycle. read the terminology about whether you're accepting or holding with upgrades, because the difference is really confusing. I made this slide yesterday and I still can't tell you the difference. It's really confusing. Essentially, when you get your offer, you have 6 different options as to how you want to respond to the offer. You can accept with upgrades, you can hold, and you can hold with upgrades, or you can decline, or you can withdraw. I'm not going to talk about decline and withdraw because I think they're quite straightforward and I'm sure you guys can work those out. The top 4 are very similar terminology and are really confusing to understand the difference between. So accepting the offer means that you're excluded from any further offers and any other specialty within this recruitment round, aside from hierarchical upgrades. I don't know what hierarchical upgrade is. Essentially, this means you're saying yes to entering that core training program. If you get your first choice offer and you're 100% sure that that's the job you want and you're 100% sure you want to start core training, you would accept. You can also hold an offer, which means you haven't committed to entering that training program. You still can make a decision up until the hold deadline. And there is a date for the hold deadline, which is slightly later on in the process. You can only hold one offer. And before the deadline passes, you either need to accept with upgrades, or decline. So when you're holding an offer, if you fail to accept that offer before the hold deadline, you will lose that offer. Does that make sense so far? I'm going to say yes because no one's complaining. Then we're going to talk about accepting with upgrades and holding with upgrades, and I'm going to move that. So accepting with upgrades essentially means that you have said yes to the program that has been offered to you, i.e., you were going to do that core training job. But if one of your higher preference jobs becomes available, then your offer will automatically be upgraded to the new higher preferenced option. If you hold with upgrades, it means that you are again in that like limbo state of you need to make a decision by the deadline. So you haven't accepted or declined the offer, but you can still be open to upgrades. So if you are holding a job that you don't necessarily want and you don't necessarily want to start that program, you can hold the offer, i.e. you haven't committed to starting the post up until the hold deadline. And before the hold deadline, you might be offered an upgrade in your list of preferences, which you would then take as your new held offer, and you would then need to make a decision on. Does that make sense? Because I know it is really, really confusing. Has anyone got any questions about that part of it? And I'll try my best to answer.
So there's 3 questions from the audience, but we'll take the 2 that focus on this part, and then anything else that is general we can maybe focus on later, because I feel like this is already quite challenging. So the first one is, do you get allocated to your top choice that is available via the upgrade, or is it random?
No, you get allocated. So the way that the job allocation works is that if you're the number 1 person in the deanery, you will be given your number 1 choice. If you're the number 2 person, if you're the number 1 applicant, you will get your number 1 choice. If you're the number 2 applicant, you will get your number 1 choice, unless that is the choice of the top choice of the person who is the number 1 applicant. So you will be given your highest ranking job that is available, as long as no one that is ranked higher than you has wants that job, basically, or hasn't been allocated that job. So if you are accepting with upgrades or holding with upgrades, you have the opportunity to re-preference in these upgrade cycles. So you can kind of you can change your preferences around, and then the preferencing window will close. And then there will be a cycle where they will again go through the list and they will allocate the top available preference job to each applicant in rank order, if that makes sense.
I think it's a bit more clear. There's another question from the audience, which is, what's the difference between holding and holding with upgrades?
So if you're holding an offer, but you are not open to upgrades, you're saying, I am still making a decision about the job that you have offered me, but I am not open to any of my higher ranked preferences for this job to be upgraded to one of those preferences, if that makes sense. So the situation I think that might come into play is if, say, you're trying to coordinate your application with someone else, or like, a long-term partner or a friend or family or something like that, and you're offered a job and they're offered a job in the same area, you might then think, actually, I don't want to be open to upgrades because I know that I want to be in this area. So holding a job basically means you haven't made a decision on the job. Opting into upgrades means that you're opening yourself up for your job to be reallocated based on one of your higher preferences.
Thank you. And I think with that, you also answered Melissa's question, which is, why would you choose to hold? What would you be waiting for in the interim that would affect your decision? I guess if you were holding with upgrades, you'd be waiting for a higher preference.
But if you were just holding, you might just be happy with the job that you've been offered, but maybe not necessarily sure that you want to start core training, or maybe not necessarily, you might just want to put a pause on your job changing if your personal situation changes, or things like that. I think, to be honest, it's I find it so confusing. You guys probably I'm sure you all understand this immediately and are very happy. This, I think, is so confusing, and I think it catches so many people out. So my biggest point is that when these upgrade cycles are going on, please be clear about the deadline you need to accept your offer by. Please be clear about the different terminology. And every time you go through one of these upgrade cycles, check what you are doing in terms of the offer. Check that you are, either accepting and you understand what that means. You are going to go into that core training program with the option for that to be changed to a different preference. I think, it's really, unfortunately, the words are really similar and it can be really confusing. But just make sure each time you have checked and refreshed your memory. And you can get so bored of reading accept with upgrades and hold with upgrades, but that's fine, because you're going to make the right decisions and you're not going to be in a situation where you're caught out by the deadline. So that is really my biggest point. But I hope I've kind of explained it a bit. I'm sorry that it's so blurry and unclear.
That's okay. We have one more question that we'll take, which is, do upgrades happen automatically, or do you still need to accept the upgrade offer?
Upgrades happen automatically. So if you accept with upgrades, it will happen automatically. If you, so if an improved preference becomes available before the upgrade deadline, the current offer will automatically be upgraded. But after you've done that, you can't then go back to your previous post. So it's not like you then have the option to say, actually, I wanted to be in this place with these jobs. So it will happen automatically. Holding with upgrades essentially means the upgrade will happen automatically. You can't revert to the previous offer that you were holding, but you are now holding the new offer, i.e. you can make a decision as to whether you want to accept or decline the new job that has been offered to you.
Okay, sounds good. I guess if we have any more questions, we'll take them up. We'll take them later, just so we can get to Fran's slides.
Sorry, we're nearly done. I know this is very boring. Okay, God, stop. Here we go. Preferencing timeline. So I'm hopeful that this will make it slightly more clear. So we've obviously talked about this part and the initial preferencing window. You then get your initial offers, and I'm now going to go through the upgrade cycles. So the hold deadline. So this is the deadline that you need to have made a decision as to whether you are going to accept or decline a post, is the 3rd of April 2025. Forget 3rd of April. Do like 1st of April, 2nd of April. Like, you need to know by this date, you need to have logged into Oriel and you need to have either accepted or declined your offer and made a decision on it, because after this, if you're holding an offer and you haven't accepted it, you will lose that offer. The upgrades continue until the 8th of April. So we're now going to talk about the upgrade cycles. So basically, the upgrade cycles are periods of time that I think in my year were around like 48 hours periods in between when you get the initial offer and the hold deadline. You have in each one a period of time where you can re-preference and you can reorder your preferences at that stage. And then your preferences will open for a short period of time. They'll close again. They'll go through and allocate all the jobs again. You then, if you're holding the offer, you can then choose to accept it. And that happens multiple times in between when you get your initial offer and the hold deadline. So the crucial thing to note is this deadline, which is that you can hold an offer the whole way through here. You can decide, I'm not going to definitely accept, I'm going to hold, but you need to have made the decision by this date. After the hold deadline, anyone who is still holding a post will lose that post, and only people who have accepted the offer with upgrades will continue to have upgrades going on until the upgrade deadline, which is the 8th of April. And at that point, that's when the posts are finalized. So if you are continuing to accept with upgrades, if your job here is you've accepted it, but with upgrades, it means that if you are not upgraded, you will be going into core training doing those jobs. So you need to be happy with your jobs around here. And then whatever happens here is kind of extra. Does that make things slightly more clear? No, probably not, but it's unfortunately a very, very confusing process. But in this period of time, I've known people have massive shifts in their jobs where they've kind of their rank job has significantly changed and their job's changed multiple times and they've ended up getting one of their top offers. So it's not completely kind of redundant to go into this period of upgrade cycles. I think things can massively change. But as I've said, I've also had colleagues who have failed to accept their offer by the hold deadline and have then been in a very long-winded conversation with the recruitment office to try and sort out getting back the job that they'd lost and all of this stuff. So essentially being aware of the dates is absolutely key. Making sure you check the terminology every single time is absolutely key. Making sure you do the preferencing properly at the start is absolutely key. It's as important as your interview, which I'm sure it doesn't feel like at the time because you're really, really stressed out. But to be honest, you could have the best interview in the world and do the preferencing wrong and still end up with a job that you don't want. So just please make sure that you follow the guidance, you check it every time, and that you do your preferencing properly at the start. Those are really the key things in terms of getting it right.
So I think people in the audience are saying that it is clearer, but I also wanted to remind everyone that this is recorded and will be posted on our MedAll page together with all the other webinars. So closer to the time, if you want a refresher, please do make use of the recording.
Thank you. I'm just going to go through the key points and then we're done. So essentially, make sure you understand the application timeline. Make sure you're aware of the key deadlines, reread the guidance, start your preferencing early. Other things I'd say, don't make choices that are going to negatively impact your mental health, because 2 years is a really long period of time and core training is really hard. My personal tips, and I know people are split, but I would try and focus as much as you can on what you want to do for ST3. And probably at this stage, because your year is only going to get more busy and stressful as you come closer to interviews, try and have a look at your ST3 requirements for your specialty so that you can gear your core training rotations towards that set of requirements, just so that you have a broad idea of how many different operations you're going to need to have done. So you have an idea of, how many audits you're going to need to have done. For plastics especially, thinking about things like whether you're going to have any burns numbers and whether you're going to get any opportunity to work in the burns team, or whether you're only going to be offered skin and hand numbers. So those type of things are really important and will massively impact your ability to apply to ST3 and CT2. So I would make sure you don't need to worry about kind of having it already, but just having an idea of where you're going to be looking at in sort of the next 3 years is really helpful when you're trying to do planning when it comes to core training rotations. I would also advise prioritizing CT1 jobs in your chosen specialty at ST3, because of the fact that you can't change your first rotation usually because it's too short notice. And then also you will set up good links in the department. You have the opportunity to go back. You've got yourself kind of on a good track in terms of your ST3 application, but also you will have more time to be able to change things around in CT2 and more opportunity to do that once you've worked in the deanery for a period of time and you've done your exams, because at that point, really, your core training should be geared towards getting your ST3 number. So I would advise that as kind of my major piece of advice for this talk. And I hope it was helpful. I've put a link here that is a link for the Oriel user guide that I found online. There's also the applicant handbook that I would advise looking at, both for evidence upload, but also when you're going through the preferencing process. And I think Anna's going to talk about this. So I'm just going to move this. Hang on.
Thank you so much, Fran. I think maybe we can just take one more question before we look at this,
Okay.
which is, what are the ramifications if you accept a job and then later change your mind? For example, if you decide to take an F3 year.
That's actually a really good question. So I would refer to the guidance on that, but I think there is a period of time that you have to give us notice. And also, I think just make sure I wouldn't plan to do that, because there is some sort of clause in the guidance, and I'm not 100% clear on exactly how far into a training program, if you drop out of it, you then have to go through an administrative process to be able to apply for another training program, and it kind of counts against you, and you have to get letters from the deanery and things like that. And I'm not sure if that, I know that that's the case if you drop out of the middle of core training when you're applying for ST3, but I'm not 100% at what point that starts applying. So I firstly wouldn't advise doing that. I would advise, I think things don't really change very much by the time you get to the in between the hold deadline and the finalized deadline. But I think being in the game up until that point is probably a good idea. But after that, I think very carefully before you do that, and make sure you understand the implications of accepting an offer and then dropping out, because there is something in there, and I'm not 100% clear on exactly what it is, that if you drop out of a program, it then is harder to reapply, and you have to go through kind of an administrative process to do that.
Thank you. So I think we've actually answered all questions. I was answering some stuff in the background, Francis, Fran, to make it easier for you. But we have provided the feedback form on the chat. This will give you access to a certificate, but most importantly, it'll help us tailor our content so that we create events that are always helpful for you guys. And apart from that, we are also sharing our link for our collaborative Inspire study, which is a study that basically looks at the knowledge gap and the obstacles and trainees that and the obstacles that students and trainees have faced when entering plastic surgery. So we're basically trying to look at these barriers and create efforts that can tackle these barriers to make it easier for students and junior doctors like us to pursue surgery, particularly if they are from a diverse background. So we've got both an undergraduate and a postgraduate link. And again, this is run by ourselves, UK Plastics Research Collaborative, which at the beginning was founded mostly for research purposes, but we've expanded to many different things. And the results and the answers you submit are completely anonymous, but we'll basically use these for publications, presentation purposes, and hopefully to affect some policies to comment on some policies and push some policies that can benefit all of us positively. So thank you for doing both of those things, and thank you for staying engaged until the end. I think as a prospective applicant, this was honestly the most useful thing I've heard all year. So thank you so much, Fran, for your kind time.
Thank you. Oh my God, stop sharing.
And thank you, everyone. Once again, if you have any more questions, please always feel free to get in touch with us, and feel free to watch the recordings. Okay? Thank you, everyone. Have a good night. And thank you again, Fran and Katrina.
Thank you. Have a nice evening. Thank you very much for coordinating everything.
Good night, everyone.
Bye.
Bye.